Good, thanks.
Good to meet you.
Good to meet you too.
Hi. So I'm joined here now by Dr. Nick Terheyden. He is the Chief Medical Officer for Dell. So welcome. How are you?
Thank you very much. I'm great. How are you, Jessica?
I'm doing well. Thank you so much. Thank you for joining us here in the lounge. Is this your first time at xMed?
It's not. No, this is my second time, in fact.
Okay, wonderful. So any changes that you want to talk about right off the bat from last year to this year? What's everybody talking about now that they weren't talking about then?
So I think the major thing from our perspective is that when you listen to any of the presentations from the previous year, you look at it and say, wow, that's amazing, that's never going to happen that quickly. And some of the things that we heard about last year, already seeing some of that impact, you know, the genome and the sequencing.
Like what? Tell me what you're seeing.
So from the perspective of the genome and the biome, we're starting to see that march towards that knowledge. We're starting to see that impact in real life. So from an individual perspective, some of us look at this, you know, you look at it individually, I do. What's the opportunity for me? I've had my genome sequenced. From the last year, I hadn't. Now I'm starting to get insights, I'm starting to get value. I think we're seeing more of that from a patient perspective. As we look at some of the wearables, I think one of the things, you know, we all wear devices.
Sure.
I'm a big fan. We're starting to see some of the value add that people are saying, we've got to apply some clinical research. You can't just say, hey, wear a wearable, hit those. You know, fascinating opportunity to accelerate that and start to be contextual. 10,000 steps may be nothing for you.
Right.
For me, it might be, I'll never reach that. So applying context and making it appropriate. So some of it's down in the detail, down to the individual, and then some of it is the big picture when you think about the omics. One of the things that we heard about recently was the biome and the impact that has just in terms of data. Can you, I can't, I mean, mind blown is completely out of the ordinary to the extent that it exceeds astronomy in terms of data acquisition. I'm blown away by that.
Okay, so challenge for Dell then. What are we going to do with all of this data? How do you make sense of it?
You couldn't have asked a better question. From our perspective, obviously, we see that as the lifeblood of the future of medicine, and then tying all of those connections together. And from the perspective of anybody managing that data, I know we've got these great devices, we can carry it, but the reality is you can't manage it, you can't secure it, you can't back it up, and then you can't do things with it. It's just too big. So from our perspective, we see it as a fundamental to be able to deliver that, manage that. We've got 11 billion images in our vendor-neutral archive today. We're adding in additional elements, so we're now starting to put the genome and the context of that, and we're offering insights into that says, we've already got the data, let's offer some value.
Yes.
So we've partnered up with some companies, xMed that takes your imaging, looks at the pixels, so not the reporting data, and says, let's dig into images that you've already had done. So you've had the exposure, and we can start to offer you some insights. Are you going to suffer from osteoporosis? Are you suffering from osteoporosis? You're going to have some challenges with heart disease, liver disease, clinically validated. Any physicians involved? No. So it's not additional workload from a clinician standpoint. Obviously, I come at it from that perspective. And it gives patients some insight. We can gather those patients. And now what we do is we focus our attention on the people that need it. And the others that don't, we're not doing anything because at this point we're just monitoring and making sure things are okay. So we see it as securing, managing, offering that up and then backing that up as the core fundamental. And then finally is to link it all together. So it's great, you've got all these images and then you've got genomics and the proteomics that will come on. What we're now looking for is the insights, and I think we're just scratching the surface.
How far are we from this? How far are we from getting all of this data to the insight to something actionable? What's this? Give me a state of play.
So I was asked to write something for Health IT Week last week. You know, imagine healthcare in the year 2030.
Okay.
And my perspective on that, we would be seeing, first of all, intelligent devices. Your bed would be intelligent. It would interact with the AIs in your house. determine you didn't sleep well and offer some opportunity for extra sleep and not wake you up, change your food intake to give you a more appropriate meal and so forth.
Sure.
You'd have a personal drone pick you up, take you to work. I genuinely, we're talking 15 years, and if you go back 15 years, we'd only just sequenced the genome. And then work from a clinician perspective is more about this rather than the technology, and focusing on all the insights and pulling that together so that I would have a conversation with you and you'd bring in your husband, your children, your mother, whatever it happens to be, and we'd have this fully engaged discussion about all the choices that the AI and everything that we know about healthcare today to make some decisions about your choices and what you can do. 15 years, I'm already thinking that's probably too far. It's going to be closer than that.
Oh, goodness, I hope so. I'll wait for my drone to pick me up.
Yeah, we're all looking for that. I know, you suffer the same traffic, right?
So I want to know too, I'm curious to know, as far as patient ownership of data, that's obviously been something that has been, as more data inputs are coming in and data is getting more and more personal down to that cellular level, what do we need to be mindful of in terms of patient ownership of data and some of the policy and security and questions about privacy around that? What's your stance and what's Dell's stance as far as that's concerned?
Well, so first of all, to camera, I want to show people my jacket, which is part of the patient engagement and the walking gallery, which really commits the issue of patients being involved and owning that data. I'm obviously a big proponent of that. I think we at Dell certainly see that from a perspective. It's your data. You own it. You ought to be able to contribute it. I think the underlying principles that most people work from is I'm willing to share and give it up as long as you don't use it against me. And as you get sicker or reach, issues of severe challenges from a healthcare perspective, we become more willing to share information. But ultimately, we have to put in protections and privacy to make sure that you're not disenfranchised as a result of all of this sharing of data. From a patient engagement standpoint, this walking gallery represents something that's been around for a while. Regina Holiday started this. Fantastic lady. I'm privileged to be wearing a jacket. The one thing I would say that we have failed to do, and xMed has been great. They've included patients and we've seen them, but I just saw data in the last couple of weeks that said patient involvement at healthcare conferences has stayed at a steady 3%. That's awful. Absolutely awful. And we need to fix that because ultimately, so you and I can talk about it from a professional standpoint, but I'm here as a patient as well. And really that's more important, and making sure that that voice is part of it. Some radical thinking, including patients in the whole process of designing medical school, the medical education. Think about that, being on the selection committee, having patients involved in the running of hospitals. Ask a patient a question one time and you'll go, oh my Lord, we shouldn't be doing this.
We should have asked them from the beginning.
So absolutely fundamental. And Leonard Kish, true hero, he and Eric Topol have essentially pushed this issue of patient engagement. And Leonard Kish said, and I agree 100%, patient engagement is the blockbuster drug of the century. Getting people involved revolutionizes healthcare. And from our perspective, the opportunity to allow them in shouldn't be allowed. They should be incorporated. And if I could put patient engagement into a pill and sell it, I wouldn't be here now. I'd be on my nice house looking out at the bay on Coronado Island. People would fall over themselves. It's so effective.
In addition to the patients, I know this year in particular, it seems like there has been an increased emphasis on the provider experience as well, and engaging providers in innovation. So I know the American Medical Association just launched their Provider Innovation Initiative to bring providers into the fold. How do they fit into this as well?
Yeah, so obviously I'm a clinician, so I'm not just a patient. I have the beauty of multiple lenses to look at this, and I'm still passionately a clinician. One of the reasons that I got into healthcare was about patients and delivering care. I would credit all of my colleagues with the same drive, the same passion. And what we have to do is to enable that. one of the things that I would say is technology, for the most part, has not been an enabler. And Michael Dell says something that I repeat frequently, and it's technology has always been about enabling human potential. And we've failed to do that in healthcare. We've done it in other industries, and I think we're now on the cusp of turning all of this investment that we've made into healthcare contribution that decreases the physician's focus on whatever the technology is and focus on this. Because when you go and see your clinician, you're not looking for me doing this. You want me to be focusing. You want that face-to-face attention, right? And that's been our challenge, and I think that's the key aspect of this, to bring them along. The one thing I would say about the AMA that I think is important, at the same time that they said that, that was the same time that they described digital health as snake oil, which I think was a little bit disingenuous on their part.
Okay.
I think, you know, is there snake oil in there? Absolutely. And we do need to tease that out. We're seeing a lot of that at the conference here today. But it's not snake. It's the enabler for us to deliver better, faster, cheaper healthcare, and to deliver it to everybody, not just the population that can afford it. So it disintermediates this barrier that comes with social status, cost, geography, and allows access. Coming from Africa, I see that, especially with technology enabling, I think they're going to leapfrog us over and start to deliver potentially better, more precision healthcare in these remote areas through telemedicine.
Right. No, I agree with you. So what does the U.S. healthcare system need to do? The established system that's in place, the legacy companies, what do they need to do in terms to shift their thinking in order to be able to evolve and incorporate new technologies more quickly?
So before I answer that, you did say that this interview was only an hour long, right?
We're going to be here with Dr. Van der Heyden for the rest of the conference.
Yeah, so I wish I could answer that as completely as that I think it needs. I think there are some fundamentals. We clearly have to change one of the core principles, that's incentive. Currently, we don't have a health or a wellness system. We have a treatment system that is paid to do stuff. And if you incentivize, that's what you get. So at its core, you have to fix that.
Yes.
You have to reward behavior that's appropriate for keeping people well. And primarily, when you understand that from a health standpoint, 60 to 80% of the conditions that we suffer from and all the impact in terms of healthcare and the health that we have to deliver is all lifestyle related. So if we don't fix things outside of the hospital can't be the focal point. It really should be the place of last resort. And I say that, you know, with due deference to my hospital colleagues. It's not that they're, you know, a Hail Mary pass. It's we can't be spending all that. We've got to fix things up front and then allow that piece of the system. So I think focusing up front, enabling people to make better choices, and disintermediating this barrier that exists for the people that are disenfranchised from the healthcare system through geography sometimes, finance, and in some instances it's just family related. All of those issues have to be taken away. That's a big laundry list.
It is.
But fix the fundamentals of the incentive, and I think a lot of this might flow appropriately.
Excellent. Well, Dr. Van der Heyden, thank you so much for joining us here live from the Insights Lounge.